Welcome to Permission to Breathe, a transformative podcast dedicated to providing a safe space where you can inhale deeply and exhale freely while embracing your grief journey unapologetically. I am your host, Dr. Tammy Isaac, a spiritual practitioner, grief advocate and educator, author, and your guide on this journey through grief. This space was born out of the understanding that grief is not just an event, it's a lifelong unfolding. It's layered, it's complex, and often it's silence. And here is where we disrupt the silence. We will talk about the grief that lingers after the food stops arriving at your door, the grief that remains when no one calls and no one comes by to check on you, the grief that's complicated, the grief that's ancestral, the grief that lives in your body long before it ever reaches your tears. Every episode, we honor the humanity of grief, the anger, the confusion, the numbness, the longing, and we do so without apology. Whether you're navigating fresh loss, unspoken sorrow, or the weight of a world that just won't pause, this podcast invites you to sit down, breathe deeply, and give yourself the permission you've been waiting for to grieve, to feel, to breathe. Let's begin. Today's episode is sponsored by Let the Church Grieve by Dr. Tammy Isaac, a compelling book that explores the often overlooked subject of grief within spiritual communities. Dr. Isaac combines personal antidotes with theological insights, providing a compassionate framework for understanding and addressing grief collectively. This book emphasizes the need for spiritual leaders to create safe spaces for mourning and guides congregations through the grieving process with faith and empathy. It's a must-read for anyone looking to support those experiencing grief within their spiritual communities. Grab your copy of Let the Church Grieve at www.drtammyisaac.com today and begin the journey towards healing and growth. Now back to our show. Welcome to the Permission to Breathe podcast, a sanctuary where you can inhale deeply and exhale freely, embracing your grief journey unapologetically. I'm your host, Dr. Tammy Isaac, spiritual practitioner, grief advocate and educator, author and host of the Permission to Breathe podcast. This week, I had the opportunity to speak with occupational therapy students at the School of Health Professions about death, dying, and the role healthcare professionals play when a person is approaching the end of life. The presentation was called Understanding Death and Dying, a multidisciplinary look at the dying process and occupational therapy's role. But as I stood before those students, I realized that this conversation reaches beyond just one profession. It is a conversation for healthcare workers, a conversation for caregivers, a conversation for families. And honestly, it is a conversation for all of us because death is one of the few experiences that touches every human life. Yet, even though death is universal, many of us still struggle to talk about it. We avoid the conversation and change the subject. We tend to use softer words because saying that someone is dying can often feel too final, too uncomfortable, or just too frightening to discuss. And some people have never been present with someone who was dying. Others have been present, but no one explained what was happening. They watched the body change and they notice a decrease in appetite, irregular breathing, withdrawal, maybe some restlessness or changes in awareness, and they wonder whether something was going wrong. Now, sometimes what looks frightening is actually part of the body's natural process of preparing to die. And understanding that process does not remove the sorrow. It does not make the loss any easier, but understanding can reduce confusion. It can help families recognize what is happening and help them ask better questions or allow them to become more present during a time that can otherwise feel very overwhelming. So Before we move any further into this conversation, I want you to pause and reflect on these questions that I'm going to ask you. How do you feel when you think about death? Do you avoid conversations about death? Have you ever been with someone who was approaching the end of life? And if so, what did you notice? What frightened you? And last question, what did you wish someone had explained before that moment? Right? Oh, wait, here's another one. And what do you believe a person needs most when medicine can no longer cure the illness or restore the body? Okay, I want you to reflect on those questions. Maybe you can write it down and just spend a little time with each of them, because these are not questions with simple answers. They are questions that invite us to examine our own fears and beliefs, culture practices, faith, traditions, and experiences with loss, because the way we understand death often shapes the way we care for people who are dying. So for many years, healthcare has been centered around fixing and treating, curing, and extending life. And those goals are very much important, but then there comes a time when the central question may need to change, right? So instead of only asking what else can we do, we may need to start asking what matters most to you. What brings you comfort at this time? Who needs to be present for you right now? What are you hoping for? What are you afraid of? Maybe are there any spiritual or cultural practices that need to be honored for you at this moment? Another question is there anything you still want to say, to do, to complete, right? Or to pass on to somebody else? The difference is these questions remind us that a dying person is still living. They still have a voice, they still have relationships, and they still have memories and preferences, fears, hopes, and needs. And even when there is nothing left to fix, there is still someone to honor. Now, in this episode, we are going to talk about the physical and emotional process of dying, the grief that can begin before death occurs, the role of culture and spirituality, and what it means to provide presence-based care. We're also going to explore a truth that I believe is essential for healthcare professionals, caregivers, and families. End-of-life care is not only about helping someone die comfortably. It is about helping someone live meaningfully until they die, right? So let's take a deep breath together and give ourselves permission to remain present with this conversation, even if it feels uncomfortable, because learning how to speak honestly about death can help us care more compassionately for the dying and support grieving families and consider how we want to be cared for when our lives approach that final chapter. Let's begin. One reason death can feel so difficult to discuss is because many of us have learned to treat it as something separate from life. We speak openly about birth, graduation, marriages, careers, and retirement. We plan for beginnings, transitions, and accomplishments. But when the conversation turns toward dying, many people become quiet. And death is often treated as if speaking about it will somehow bring it closer. For some people, the silence comes from fear, and for others, it comes from painful experiences. Some people watched someone they loved die and still carry unaware or unanswered questions about what happened. Others were kept away from the dying process and were never given the opportunity to say goodbye. Then there are some people who grew up in families where death was discussed honestly, while others learned that grief should remain private. Our religious beliefs and culture traditions also influence how we understand death. Some people believe death is a homegoing, and some people understand death as a return to God. Some see it as a transition into another form of existence, and some believe in resurrection, reincarnation, or the continuation of the spirit. Others may hold a religious belief about death, but still find meaning in relationships, memories, legacy, and the impact a person leaves, behind. Now, all of these beliefs shape how people approach dying and how they respond when someone they love is nearing the end of life. But avoiding the conversation does not prevent death. It often leaves people less prepared when death does come. Families may be asked to make difficult decisions without knowing what their loved one actually wanted, and they may not understand the changes that they are seeing in the body. They may interpret a natural part of the dying process as neglect or as a medical emergency, which I see often, especially in hospice and in my hospital work as a chaplain. Now, healthcare professionals may also feel uncertain about what to say when treatment is no longer working. Many of the healthcare disciplines, they are trained people to assess, to treat, restore function, reduce symptoms, and solve problems. Professionals are taught to intervene, right? They are taught to measure progress and work toward improvement. But what happens when improvement is no longer possible? What happens when the disease continues to progress despite every available treatment? What happens when a person says, "I'm tired. I do not want to do therapy today"? That moment can be uncomfortable because it challenges the belief that good care must always involve doing more. Sometimes good care requires us to recognize the goal has changed, right? The goal may no longer be rehabilitation, but the goal now may be comfort. It may be helping someone conserve enough energy to sit with family, or it may be reducing unnecessary distress. The goal may be helping a person participate in one meaningful activity or supporting a final conversation, or even if the goal even may be just helping the person remain as independent as possible for as long as possible. And even think the goal could also simply be just allowing the person to rest without making them feel though they have failed, right? This is where healthcare begins to shift from a cure-centered approach to a care-centered approach. Because cure asks, how do we stop the disease? Cure also asks, how do we support the person living with the disease? Care also asks, how do we support the person living with the disease? Cure asks what intervention can be done. And then care asks, what does this person need from us right now, right? So cure is focusing primarily on what is happening in the body, while care, on the other hand, it recognizes that the person is also experiencing emotional, relational, spiritual, and culture and practical changes within themselves. And this does not mean that treatment no longer matters, but it means that treatment should remain connected to the person's goal, but it's not necessarily the top of the goal. Now, in his book, Being Mortal, Dr. Atul Gawande challenges the way modern medicine sometimes focuses so heavily on extending life that it tends to fail to ask what makes life meaningful to the person who is living that experience. And the question, he says, is not only how much longer can we keep someone alive, but it should be more like, what kind of life are we helping this person live? And that's a great distinction. And that distinction matters because a treatment may extend life, but it may also bring pain, confusion, repeated hospitalizations, loss of independence, or even separation from people and surroundings that matter the most to them. For one person, pursuing every possible treatment may be consistent with their values, but for another person, remaining at home, maintaining comfort, or having time with family is what matters the most to them. So it's important to recognize that neither choice should be assumed, right? We have to ask, what matters most to you is the question that we must ask. What are you willing to go through for the possibility of more time? What abilities are so important to your quality of life that you cannot imagine living without them, right? We need to ask questions that are asking, what are you most afraid of? What does a good day look like for you at this stage in your life? What do you trust to speak for you, or who do you trust to speak for you when you know? We need these types of questions. These questions are not signs that we have given up. These are signs that we are listening. And they remind us that patient-centered care is not simply about offering every available intervention. It is about understanding the person's values and helping their care reflect those values. And this is especially important at the end of life because dying can create a sense that control is being lost. And this is so very familiar to me as a previous hospice worker. The body is changing, roles are changing, relationships are changing. A person who has always cared for others may now need help with basic tasks. And someone who has always been independent may need assistance eating and bathing, dressing, and moving from one place to the other. Someone who has always been the decision maker in the family may now begin to depend on others to speak on their behalf. And these changes can bring grief long before death occurs. The person may grieve their strength, their privacy, their independence, the future they expected to have. They may grieve the experiences they now know they will not live to see. And family members may also begin to grieve before the death, right? They may grieve changes in the person's appearance or personality. I just had that incident today at the hospital. They may grieve the conversations they can no longer have. They may grieve the roles that are beginning to shift, right? Think about a spouse who may become a caregiver, a child who may begin making decisions for a parent, or a family may begin imagining life without someone who is still physically present. This is one reason conversations about death and dying matter so much, because they help us recognize that grief may already be present in the room. It may be present in the patient who is losing their independence, and it may be present in the family member who is trying to remain hopeful while noticing that the person really is declining right before their very eyes. And then it also may be present in the healthcare professional who knows The treatment is no longer helping, but does not know how to name what is happening. But when we make room for these conversations, we're not taking away hope. We are helping people understand what hope may look like right now. Hope may no longer mean cure. It may not mean comfort. Hope may mean one meaningful conversation now. It might be being free from pain for a short time or returning home. It may mean reconciliation with someone. It may mean seeing one more family member, right? It can mean so many things. It could mean being around family. It could just mean dying with dignity. And the form of hope may change, but hope does not have to disappear. This is why understanding death matters. It helps us move beyond fear and avoidance. It helps healthcare professionals recognize when the goals of care need to change, and it helps families prepare for what they may see. And it also helps the dying person remain part of the conversation. And it reminds all of us that even when life cannot be prolonged indefinitely, meaningful care is still possible. Let us talk about what may happen as the body approaches death. This part of the dying process can be frightening for families because the changes may be unfamiliar. When people do not understand what they are seeing, they may assume that something is wrong or that their loved one is suffering. Barbara Carnes, in her book, Gone From My Sight, helps families understand that dying is often a gradual process. It may unfold over months, weeks, days, and final hours. Now, for every person, it's different. Not everyone will experience the same signs, and the signs may not appear in the same order, but understanding the general process can help families respond with less panic and more presence. So as death approaches, a person may begin to withdraw. They may sleep more, speak less, and show less interest in visitors, food, or activities that they once enjoyed. This can feel painful to families and loved ones, and it may seem as though the person is pulling away from them, but withdrawal does not necessarily mean rejection at this point of their lives, right? The person may have less physical and emotional energy. Their attention may be turning inward as the body begins to slow down. And during this time, presence does not have to depend on conversation, right? You can sit beside them, you can hold their hand, you can play music, you can read scripture, maybe a poem or a favorite passage from a sacred text. And you can speak calmly if they are no longer able to respond. You can still talk to them, and you can let them know that they are not alone. And a person's appetite and thirst may also decrease. And this is something that families I see tend to struggle most often and have difficulty really understanding them not wanting to eat. So it is, they prepare meals, right, for the people that they love, and they encourage them to eat when they're sick. And so we associate eating with strength and with recovery. So when a dying person stops eating, family members may feel that they must persuade them to eat. Like I had a patient today who's dying, and her daughter is like, you got to eat something. And she said, oh, my mom's just stubborn. She's always been stubborn. She just doesn't want to eat. And I was trying to encourage her and let her know, like, no, this is normal activity when the body is dying. But in her mind, she was thinking she needs to eat. She needs a strength. And she was like, you want me to go buy you some French fries and all of this? And of course, the mom just said yes to appease her. But of course, the mom still did not eat the French fries, right? And it's because near the end of life, the body no longer processes food and fluids in the same way. The person may not experience hunger as a healthy person would. So forcing food may create discomfort, nausea, or even difficulty swallowing. So care may need to take a different form, a different approach. It may mean offering small sips when appropriate, or it may mean just moisturizing the mouth and the lips so that they don't get dry. It may mean offering a favorite food without pressuring the person to finish it, right? Families may need reassurance that a decreased appetite is often part of that body's natural process as it dies. Now, the person may also become weaker and need more help with movement and personal care. And tasks that once seemed simple may require so much more energy than the patient or the person may have available at the time. And so this is when goals of care may need to change. So instead of asking, how can we make this person do more, we may need to ask, how can we help this person use their remaining energy for what really matters the most at this time? So perhaps they don't have energy for a full therapy session, but they want to sit in a chair while family members visit. So perhaps they cannot walk down the hallway, but they want enough support to sit near the window so they can see, people, or be pushed in a wheelchair down the hallway. So perhaps they cannot complete an activity independently, but they still want to participate in some type of small way that will consume less energy. So at the end of life, meaningful care is not always about restoring function. Sometimes it is about just adapting life so the person can remain connected to their identity, their relationships, and dignity. Now, the other thing is breathing may change, okay? So it may become irregular with periods of rapid breathing, slower breathing, or pauses between breaths. The breathing may also become louder because the person may no longer have the strength to clear their secretions from their throat. So oftentimes, healthcare professionals are helping them to remove the secretion. These sounds can be upsetting for families at times, right? It may sound as though the person is struggling, or choking or of some sort, right? But healthcare professionals can help by explaining what is actually happening and assessing the person's comfort and also answering the family's questions honestly. And I'm always also reminding families quite often is that if you don't understand and maybe it's not been explained or you still don't understand after it's been explained, to ask questions again, to ask continuously until you get to a point where you can understand. And also it is important to have pen and paper with you or your phone so that you can take notes or record if it is welcome, so that you can go back and listen to it so that you can have a better understanding. Because when the body and mind is under stress from caregiving, it's easy to forget what was said or misinterpret what has been said. And I've seen this done often. Now, the next thing is skin changes may also occur as the circulation begins to slow down within the body. So the hands and feet may become cool. The skin may appear pale and blushes or begin to mottle. And these changes can look very alarming, but they are often signs that the body systems are slowing down. And some people may also become restless or confused. And they may pull at their clothing, at their bedding. They may try to get out of bed even when they are too weak to stand. Now, restlessness can have different causes. So it's important for the healthcare team to assess what may be happening actually at the time. So the goal is not to dismiss the behavior as simply part of the dying process, but then the goal is to observe and ask questions and respond to the person's needs, right? Some dying people also will begin to use what we call symbolic language. They may talk about going home. They may say they need to pack. They may speak about a journey, a doorway, or someone who is waiting for them. They may also say they see family members or friends who have already died. Now, when this happens, family members may try to correct them, which is I've seen often as well. But it may be more helpful just to listen, right? As they're sharing or saying what they see, you could just ask, like, what is, if they say, like, I want to go home, then you ask them, what does home mean to you? Or who do you see, or who do you feel safe? Is there something you need, right? A lot of times as a chaplain in hospice and being with patients that were dying, I experienced this quite often. And I would simply ask, tell me what you see, right? Explain to me, describe it. Or if they see a particular person, I'll say, who is that person? I ask them about that person and allow them to give me a description of what they see. And I even had one lady say to me, she was just smiling really bright. And I remember saying, what are you smiling at? And she said, you don't see it? And I said, no. And she started to describe to me what she actually saw, this very beautiful picture. And it brought joy to her heart at that moment. So we want to engage them in what they are seeing and not correct them. So the purpose is not to argue about whether the experience is real. The purpose is to understand whether the person feels comforted or distressed and to respond with respect, right? Because as the final days or hours approach, the person may become less responsive and they may no longer speak or open their eyes, but a lack of response doesn't necessarily mean a lack of awareness. Okay. So families can continue to speak to the person, say what needs to be said, express love, share gratitude. You can ask for forgiveness. You can offer reassurance to them. A lot of times people will give people permission to rest. Sometimes we just, hey, I love you. I want you to know I'm here. You have cared for me greatly. We'll take care of one another. Things like that. These words may feel, or no, these words may be difficult for you to speak, but they can become a real act of love for your loved one and the patient that is dying. It is also important to remember that recognizing the signs of dying does not mean anyone can predict the exact moment of death. So a person may appear close to death and continue living for several days. Another may decline more quickly than expected. So this uncertainty can be really exhausting for families. Sometimes I've had where people go, man, they're just hanging on. We gave them permission. We told them we're going to be good and we're going to do all this. And we said all our goodbyes, but they still hanging on. What are they waiting for? Right. So it sometimes it can be very, overwhelming for families and exhausting, right, in that waiting period. They may be afraid to leave the room when this happens. They may feel guilty if they step away to sleep or to eat or to shower. But the truth is families cannot control the exact moment, the timing of a loved one's death. Sometimes a person dies while everyone is gathered around the bed. And then sometimes they die when the room becomes quiet or as someone steps away. There is no single correct way for death to occur. Now, being present or being absent at that exact moment of death does not erase the love and care offered throughout the person's life, right? Understanding the dying process does not remove sorrow, but it can help to reduce a bit of confusion that often happens at the end of life. It can also help families recognize that some of the changes they are seeing are part of the body's natural process, right? And it can help healthcare professionals prepare families before changes become frightening. And it can also help everyone shift from trying to make the person return to who they were toward caring for who they are right now. Then the question becomes, how do we accompany someone as death approach? How do we protect their dignity? How do we honor their wishes? How do we make the environment calmer? And how do we remain present when there's nothing left for us to fix? As we bring part one of this conversation to a close, I want to return to one simple truth, and that is understanding death does not make loss easy, but it can make the dying process less confusing. Now, when families know that withdrawal, decreased appetite, changes in breathing, weakness, restlessness, and reduced responsiveness may be a part of the body's natural progression when dying, they may be better able to respond with less fear. They may still feel sorrow and they may still feel uncertain, but they may also be able to recognize that not every change is a crisis and that not every moment requires another intervention. Sometimes the most important thing is to understand what is happening. Sometimes it is to ask better questions. Sometimes it is to stop measuring care only by whether the person is improving. And sometimes it is to allow the dying person to remain part of the conversation about their own lives. That means asking questions like what matters now. It means listening to what they want. It means recognizing when the goals of care have changed. And it means remembering that the person who is dying is still living. They are still connected to family, culture, faith, memory, identity, and meaning. Another thing to remember is death is not only a medical event, it is also a human experience. It affects the body, but it also touches relationships, beliefs, roles, hopes, fears, and the way people understand what their life has meant. Now, in part 2, next week, we are going to continue this conversation by talking about the grief that can begin before death occurs. We will look at the emotional experience of the dying person and the family. We will also talk about culture and spirituality at the end of life, and we will explore dignity, legacy, and meaningful activity, and what it means to care for someone when the focus is no longer on recovery. But until then, I want to leave you with one question, and that is, what would you want the people caring for you to understand about what matters most to you at the end of your life? Now I want you to take some time and really sit with this question. And perhaps, just perhaps, when you are ready, begin the conversation with someone that you trust. This has been the Permission to Breathe podcast, a sanctuary where you can inhale deeply and exhale freely, embracing your grief journey unapologetically. I'm your host, Dr. Tammy Isaac, and as always, you have permission to breathe. Thank you so much for joining me today on the Permission to Breathe podcast. I want to invite you to sit with it just a little bit longer. Notice what came up, notice what feels heavy and what feels clear, and know that there is no rush to resolve any of it. You can also read the companion blog to this episode found on my website at www.drtammyisaac.com along with the show notes. If this conversation was helpful, you are welcome to share it with someone who may need it, or leave a review so others can find their way here. And join me next Monday for a new episode of the Permission to Breathe podcast. And as always, take care of yourself gently. And until next time, give yourself permission to breathe.